Hello, hi, I am Samina Dornan and I'm a consultant maternal fetal medicine in King's College Hospital, London, Dubai. We would love to see you here, and you might wonder what is different about King's College Hospital, Dubai. What is different is that we give you the excellent care. We bring the excellence from United Kingdom, combining it with the excellence of the local region. So you will have everything in one hospital. You don't need to leave the hospital no matter what specialty you need. Maternal fetal medicine is a high-risk specialty. So if you are a mother with high-risk complications, or your fetus has a high-risk complications, or you have had complications in your previous pregnancy, or your baby had a complications in your previous pregnancy, or if you have a family history of complications, then this is the hospital to come to, because we can deal with all that. So people usually ask about scans. What type of a scans I should have in my pregnancy, how many of them, and how far apart they should be. So the most important scans are usually about 3 or 4 in pregnancy. One is, of course, the booking scan, which we call it, or the nuchal scans, which are called. That is performed at around 11 to 13 weeks of pregnancy. In that scan, we can measure the baby and date the pregnancy. We make sure that the baby is okay. We do an early anomaly growth. We look at the fluid around the back of the baby's neck, which is called nuchal translucency. And then we talk to you about further screening tests, which can be a combined test or a very new test, NIPT, or commonly known as Harmony. The second scan is usually around 20 to 22 weeks of pregnancy, when we look at the fetus in a lot more detail and look at all the systems of the baby to make sure that structurally that baby is normal. The third scan usually is performed around 34 weeks of pregnancy, when we look at the growth of the baby to make sure it is growing well and there are no other complications or structural defects which can be developed later part of pregnancy. And the last scan, which I usually would advise, is around 38 weeks of pregnancy, when we look to make sure that the fetus and the placental reserves are working well together, and we can leave you up to your expected date of delivery. So, and of course there are many more scans which should be performed in pregnancy, but these are the major ones that I wanted to talk to you about. If you have any more questions, come to King's College Hospital, London, Dubai. I'll be more than happy, and my colleagues will be more than happy to see you and advise you further.